Hi, my name is Dr. Michael Grudoria, and I'm a board-certified chiropractic neurologist. I'm a fellowship-trained functional neurologist, as well as I'm trained in functional nutrition and clinical biochemistry. So what makes us different from every other doctor you've already seen for your migraine headaches? Well, we treat migraines from three different perspectives, from a metabolic one, a structural one, and a neurological one. And I'm going to explain to you what each of those things are. What we have to do is get to the root cause of your problem. We don't want to just treat the pain that you're experiencing and mask it with medication or Botox injections. What we want to do is actually figure out what's wrong. So we'll leave no stone unturned to try to discover the real cause of the headaches that you're experiencing. As you know now, there's no cure for migraines, but I believe that you deserve the very best care that you could possibly get. So if you're watching this at this point, you or a loved one have been suffering with migraine headaches for some time. You've seen your doctor, probably a neurologist. You've been prescribed brain MRIs and MRAs possibly, EKG, EEG, echocardiogram, and all this testing was probably normal. And that's, you know, in a way that's a good thing because it rules out all the bad things. But it's frustrating because it doesn't really give you any answers. You were probably then prescribed anti-inflammatory medications, painkillers, steroids, possibly triptans, sumatriptan, things like Imitrex, and then even go to the next level and you start taking anti-seizure medications like Topamax. You may have even gone through a pain management program or even started on anti-anxiety or antidepressant medication, and unfortunately you probably still have the headaches. So migraines are much more than just an interruption and pain on a regular basis in your life. They increase your risk for having other kind of health conditions like stroke and other problems that we really don't want you to experience. So if you're sick and tired of being sick and tired, and I really encourage you to listen up to everything that I'm going to explain to you, because we're going to actually go through a lot of the current research as to what could be causing your headaches and what we could do to get rid of them. So migraines are primary brain dysfunctions. It used to be thought that your migraine headaches were a vascular problem in your head. And at this point what we realize is, and the research bears out, that you have a problem within the brain itself. And what we need to do is to restore what we call fuel and activation, which are the two things that your brain needs to thrive. Fuel in the source of glucose and oxygen, and activation in the area of like stimulation, brain-based activities and so on, exercise, things like that. So we have to create a new healthy environment for your brain. So again, we treat migraines from this metabolic perspective, a structural one and a neurological one. We start by testing you functionally. So we know that like an MRI looks at the structure of your brain, and hopefully that structure was perfectly fine. But you can't have migraines and have everything working appropriately, so we have to look at you functionally. So we know that you aren't broken, but something's not right, and we have to start thinking outside the box to figure that out. So what we're going to do is some metabolic testing. This is blood, urine, and stool tests that look at very, very specific markers, like a complete metabolic panel, blood chemistry, thyroid markers, what we call a micronutrient panel, which looks at vitamins and minerals, as well as a stool profile and celiac testing. We know that there's a big connection between gluten sensitivity and migraine as well. So have you been told that all your lab tests were already normal? Because many patients that come into the office say, well, I've had a lot of tests already and they were all normal. Well, functional lab values are very different from standard lab values, where we're not looking down the row and looking for what's abnormal and what's considered normal. What we want to do is look at what's optimum for you, and I'll explain that to you in a moment. See, these lab ranges are very deceiving, because there's a sweet spot within a lab range that looks at about a 10% right in the middle of the range. That's when your body is working at its best. Not whether it's really, kind of on the low end of normal or high end of normal. Those are abnormal as far as I'm concerned. Things like your blood sugar. What's considered a normal, within normal limits, would be 65 to 110 in some labs. But we know that people can have hypoglycemia at 73. So even though it's considered normal, they still have symptoms. So we don't want to consider, we don't want to put you into that category, just looking at the abnormals versus normals. We want to look at optimums. Next big thing we have to think about is something called leaky gut syndrome, where this is where you have a breakdown in the way your intestines work, and large diameter proteins leak through the intestinal lining and get into your bloodstream. And this causes a problem with the way the immune cells within your blood actually react to foods, and you develop food sensitivities and chronic inflammation. It's very important that we evaluate you for it and actually treat it if it's there. We look for active antigens because this creates something called immune dysregulation. things like bacteria, parasites, viruses, molds, yeast, all these different things, even heavy metals, can activate your immune system and create ongoing chronic inflammation. We also have to look at a stool ecology profile, which is we do a stool test that looks at a breakdown of healthy bacteria, unhealthy bacteria, and potential yeast. And we all know about things like probiotics, and we're told on a regular basis we should be taking probiotics and eat yogurt, has active yogurt cultures. But what we have to do is actually look at what's going on within your body. About 50% of the people that I see that have migraines also have gastrointestinal concerns. And across the board, about 80% of people who have migraines have changes in the way their stool profiles come back. So it's important that we quantify that. So this is an example of a stool test. We look at breakdown of food, which is called digestion. This is absorption. These are metabolic markers, and this is that stool ecology profile I just mentioned. This is beneficial bacteria, and we look at Lactobacillus acidophilus, which is what we find in yogurt. In this particular patient, there was no growth, NG. We want to see this at +4 levels. E. coli, these are the healthy ones. We want to see this at +4 levels. Again, no growth. So we see low levels of healthy bacteria, and then over here, these are all extra bacteria that we find, and these are all thriving at very, very high levels, and these ones in yellow are actually potentially pathogenic bacteria. So we want to look at what's going on within your body. We also have to test you for inflammation. So there's specific tests called homocysteine levels and C-reactive protein and ESRs that tell us about the level of inflammation that's within your system. And this inflammatory cascade can actually initiate migraine headaches. We also look for something called histamine. Histamine isn't just associated with allergies, it's actually been clinically correlated with migraine headaches, so we have to look at your levels of histamine. We also want to do some genetic testing. Have you ever wondered why so many people with migraines have family members with migraines? Well, there's a new study that came out in 2013 that actually links a gene mutation called MTHFR with potential migraine sufferers. And the nice thing is that if we find this gene mutation in you, which is based on a blood test, we can actually bypass it nutritionally. So according to this study, there was a significant increase in incidence in migraine headaches with people who had this MTHFR mutation. So what does that really mean? What does an MTHFR mutation mean? Well, this is a very complicated array of biochemical reactions within our body. It's actually considered the backbone of our physiology. Very basically, and I'll explain this to you more in detail, THF is folate, or folic acid. It comes into our body and has to get converted to something called 5-MTHF. This is the active form of folate. MTHFR is the enzyme that allows that to happen. When you have these mutations, it breaks down everything within this cycle and everything that's associated with this cycle. The interesting thing is that homocysteine, which creates inflammation, is based on your ability to do this. And also this creates vascular disease and cardiovascular disease. When you go this way, a lack of MTHF creates a change in the way your body converts these amino acids, tryptophan and tyrosine, into serotonin and dopamine, which also are related to brain chemistry. Additionally, this Krebs cycle, which is your energy production cycle, also plays a big, big role in chronic fatigue syndrome, and very commonly we see that as well in people who have migraines. So have you had all these tests by your doctors? And if not, why? We also then want to come up with a strategy to start treating you neurologically. So what we're going to do is come up with some tests to look at what's going on with neurological function, and we're going to look at your brainstem. And we look at, we know that upper active brainstem and like a hyperactive brainstem called the mesencephalon can create a lot of these different things like chronic fatigue, chronic pain, migraine, blurry vision, sleep issues. All the different things that people with migraines have can all be traced back to this area called the mesencephalon. There's also a big vestibular component, meaning the balance system in your body. Within your brainstem and in your inner ear, you have this area called the vestibular system. And balance and coordination can very much be tied to migraine headaches. And also, when you look at the connection between the brainstem and this vestibular system, you can see it's correlated directly with the blood flow in your brain. And there was a study that was done on the vestibular effects on cerebral blood flow. And what we want to make sure is that we are evaluating this vestibular system and actually enhancing it and training it. And we use specific testing in the office called VNG, video nystagmography, where we actually use this goggle system to be able to measure eye movements and the speed at which your eyes move, and that tells us a lot about the brainstem. We do a comprehensive neurological testing, and we look at specific vestibular tests and eye movement testing, reflexes, and we're comparing everything from side to side. Not just whether or not it's there, but the quality of the tests and how it's functioning. And do you have a reduced function on one side of your body versus the other? Because that tells us a lot about changes in the way your brain is working. So what can be done? Migraine is not a disease, but it's a label for this specific type of headache. And it's actually based on dysfunction within your body. So the only way to fix this dysfunction is to restore function to these metabolic, neurological, and structural systems. And it's a process. It takes time. It's like a rehabilitative process, but it works. We do brain-based therapies. So we do these balance or vestibular therapies, things called eye lights, optokinetic tape, hemi-stim programs, therapeutic exercises, chiropractic care. So many different things all go into an individual patient's program, and they're all very much individualized. We use oxygen because we know that oxygen is key to overall brain function. So we can increase activation of your brain through exercise with oxygen therapy. So we have to correlate all the different aspects of what's going on within your system and bring them all together. So when all these pieces are working together at the same time, like nutrient deficiencies and blood sugar normalization and gut function and oxygen and brain balance and also cerebellar function, when everything comes together, your body starts working appropriately again and the pain goes away. So how have migraines affected your relationships, your family, your finances, and other activities? And are you enjoying life to your fullest at this point? How much of these migraines cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 3 to 5 years if the true cause of these migraines are not treated? And are you ready to try something completely out of the box to potentially attack the cause of what may be causing these headaches? So the bottom line is that in order to change, you have to really be at your breaking point, because it takes a lot of work. We usually put people on strict diets, change supplement intake. We do a whole brain-based therapeutic program within the office. So it's a process. We work together, but we work together on making this better. And I'd invite you to download our special report right here on the website, and we will come to a point where we're able to come up with a strategy for you, invite you in, do a consultation, and create a program. And I look forward to treating you and seeing you very, very soon. Have a great day.